What will it be like when my child is in the hospital?
So something that might surprise you after surgery that you haven't anticipated or thought much about is your teen's behavior. So this happens because of the emotional roller coaster combined with the pain of surgery, the pain medications they're taking after surgery. Sometimes that perfect storm of that teenager creates some emotions that happen to come right back at you that you weren't expecting. So just as a cautionary, I think that some parents don't anticipate swearing sometimes happens to kids that have never sworn before. They don't know what to do, and unfortunately that oftentimes comes out at the parents, the moms sometimes more specifically, and it's emotional for the parents too. So just know that if it does happen, it's normal, it will pass. We're not offended if they happen to talk rudely to us or anything. It's just something that they're going through. So nothing anybody's done wrong, and you'll get them back to how they normally are.
That's a very good question. One thing that I'll frequently say to patients' parents, for instance, when I come out of the operating room after doing a long surgery, is when they tell me, "How are you doing? That was a long surgery," I say to them, "I can't imagine how long it was for you if you felt like it was long for me," because waiting for your child while they are in surgery can be incredibly anxiety-provoking, and the time can really seem to drag on. So I would say that one thing you should be prepared for while your child is having surgery and in the hospital, bring something to kind of divert your mind. Bring a book with you, bring an iPad with you, get up and take walks around the hospital. Do things that somehow make the time begin to pass a little bit faster. When you come in the morning of surgery, you're going to encounter a number of people in the pre-op area. You're going to be encountering the preoperative nurse who will be getting you ready for surgery and who will be kind of covering a lot of bases with your child's general health and asking a lot of questions. You're then going to encounter the certified registered nurse anesthetist. Frequently, it's our nurse anesthetists that begin the IVs. IV placement can be an anxiety-provoking experience for patients, so we do everything we can to minimize any discomfort surrounding that, whether or not it means thinking about utilizing a medication that might allow them to relax a little bit, or whether or not it's also using a topical material that helps anesthetize or numb the skin where that IV might go in. But needless to say, that can be an anxiety-provoking experience. After that, you'll generally meet the anesthesiologist, who will go over the details of the anesthesia portion of the surgery itself and how your child will wake up, and who will ask a number of questions again about your child's general health. And then finally, you'll encounter me in that preoperative area or one of my partners that'll be performing the surgery. And at that point, you're going to be signing something called the consent. The consent is a document that suggests that we've discussed all of the risks and benefits surrounding surgery and that we all feel that the benefits outweigh the risks, and therefore the reason that we are doing the surgery. It's essentially your providing approval to us to perform the surgery. After that, what you can expect is your child will go back to the operating room. In most circumstances, a parent, one, is able to go back to the operating room with their child while their child goes off to sleep, and they can usually then leave the room. The nurses in the operating room thereafter will update you about every hour to hour and a half during surgery to let you know how things are proceeding and going along. In general, there tends to be a call when we get started with surgery, which in most circumstances I'll tell families tends to be about an hour to an hour and a half after your child goes into the operating room that we actually get started. And then finally they will give you a call when we get done, and at that point I or one of my partners would come out and visit with you and let you know how everything went. From there, you usually will have to wait about an hour before you're able to see your child in the recovery area, so expect that even when we're done, there's still going to be a period of time that you're waiting to see your child. And that's simply because we need to get them recovered and we need to get them comfortable. From there, your child will go to the floor, and we don't really expect much out of our patients the day of surgery. At that point, the duty is largely ours to make sure that their pain is adequately controlled and that they are able to get some rest. That said, if your child's incredibly eager to move or get up, that is something they can do with assistance, but is not an expectation we have. Once on the floor, you're going to work with floor nurses as well as nursing assistants that will help with things such as giving medications, answering questions you might have, getting your child to get up to go to the bathroom, and other things. That staff changes about every 8 hours, so over a 24-hour period, you can expect to have about 3 different nurses. And whether or not you're going to have the same nurses in the same shifts from day to day is somewhat unpredictable. It largely has to do with the staffing within the hospital. So whereas you may simply get to know 3 different nurses over 3 days, there can be other scenarios where you're meeting up to 6 to 8 different nurses. But just know that honestly, our nurses at Gillette, taking care of our spine patients, and candidly, our nurses overall are exceptional, and I promise that you will get good care. Every morning, you're going to be getting a visit from either one of the resident staff from the University of Minnesota, as we are also a training institution. You'll likely get a visit at times with one of the advanced practice providers, which may be one of the physician's assistants or nurse practitioners. And then you should see your surgeon pretty much every day that you're in the hospital. Each day that you're in the hospital, we'll check in with you and make sure that you're proceeding the way that we want your care to. And we'll have a conversation with you and your parents to assess how they think things are going and do what we can to answer questions again and take care of any concerns or fears that there might be. And finally, in general, we'll try to keep a checkboard, if we can, of activities or goals we want you to accomplish for when it's time to go home, and we'll go over those regularly. So things that we want to achieve for a parent and patient to have comfort with return to home are good pain control with pain medicines by mouth, reliable bowel and bladder function, ability to get up and mobilize relatively independently or with your parents' assistance, as well as the ability to go up and down stairs. Once those things are accomplished, in most circumstances, kids are ready to go home.
It will hopefully be some long periods of time that are boring. The first day or two, they're going to sleep a lot, and you can use that time also to get yourself prepared and talking to the nurses so that you're ready to go home. But have things to do so that you take care of yourself. Make sure you get rest. If you can, tag team so one person gets rest while the other person is busy and awake. Get away from the hospital for periods of time and let somebody else be there and take care so that you are ready when you go home, because you'll have fewer of those resources, but you'll also have fewer demands, and you're going to be more prepared, because that time in the hospital isn't just for your child, it's for you to be prepared when you go home too.
So the course of the hospitalization is going to be a roller coaster of emotions for you as a parent. The most stressful and anxiety producing part is going to be that initial period when they're actually in the operating room, from the time you see them leave for the OR until the time you see them in the recovery room. There's no way around that. That's just going to be a really difficult time. And for your son or daughter, it's going to feel like nothing in terms of time. They close their eyes, they wake up, it's over. For you, it is going to feel like forever. And that's just the nature of the beast. That's just the virtue of being a parent. After we get through that giant hurdle, the remainder of the hospitalization, again, has highs and lows, and has exciting times or anxiety-producing times, and it also, frankly, has a lot of downtime that's kind of just boring, kind of sitting around, waiting, watching TV, watching your son or daughter maybe play video games or just sleep. It's really important. There's going to be a lot of downtime during the course of the hospitalization where there's not going to be much going on. So I encourage parents and caregivers to get up and take care of themselves. Remember, in order to help your child, you have to be at your best self too. So if that's during the course of the operation or while they're taking a rest or sleeping, getting up, taking a walk, getting a coffee yourself, taking shifts. Remember, this is exhausting for everyone, and it's important that everyone stays at their best, stays rejuvenated, and stays energetic.